arteriosus. Okay? What's going to happen to the foramen ovale?
Will close at the beginning.
At the beginning, it will close physiologically, right? Because immediately after delivery, fibrosis will not occur, right? It takes time. But it will close physiologically because once the baby starts breathing and the heart functioning normally and the lungs, the pressure on the left side will be way more than the pressure on the right side. So even if you have an opening that is not too big, pressure will prevent blood from going to the left. But with time, there will be fibrosis, and that little opening will close. If it persists, they usually wait for it to close till the baby is 4 or 5 years old sometimes. But if it is too big or it does not close, they need to go and do that surgically. It's called the atrial septal defect because it is a defect in the atrial septum. So if this foramen ovale persists, that needs to be sutured and it's called the atrial septal defect. Otherwise, you will have mixing between oxygenated and non-oxygenated blood. If it is too big, baby will be blue, will be cyanosed, okay? Due to high level of non-oxygenated blood. What else do you see here? What is that opening?
Is it for the
It is called the coronary sinus. What is a coronary sinus? It is the main venous drainage of the heart itself. You know, heart, like any other organ, has its own arterial supply and its own venous drainage, which is something we will discuss in the next lecture, inshallah. So the coronary sinus, again, remember, right atrium will receive all non-oxygenated blood regardless, from the heart itself or from everywhere else, superior vena cava and inferior vena cava. What is this flap? It's called the inferior vena cava valve. It's not a valve, it's just basically a flap of tissue that will direct blood to go to the foramen ovale. So it's not an actual valve. And then you will have the atrioventricular opening guarded by the tricuspid valve. So again, to recap, in the right atrium we have the pectinate muscle, and the rest is smooth. The junction between smooth and rough is crista terminalis. Upper end of crista terminalis you have the SA node, and then you have the fossa ovalis and the coronary sinus and the non-functioning valve or rudimentary valve of the inferior vena cava. Now, if we open the right ventricle, the first thing that you notice is mostly rough. The only smooth area is just below the pulmonary valve. It's called the infundibulum or conus arteriosus. The rest is really rough. What do we have in there rough? We have this muscle. It's called the trabeculae carni. And then we have these muscles. What are they? Papillary muscles. So you will have anterior papillary muscle. You will have posterior papillary muscle. You will have septal papillary muscle. Okay, what is this then? If this is anterior, that is posterior. What is this here?
The band.
What band? Moderator band. It's called moderator band or septomarginal band. It comes from the interventricular septum and it is attached to the anterior papillary muscle. It's part of the conduction system. We don't have it on the left side. Okay, on the left side we don't have the moderator band. And then you will have the cusp, anterior cusp, posterior cusp, septal cusp, and the chorda tendinite. So in the right ventricle, number one, it is all rough, except below the pulmonary valve. It's called the infundibulum or conus arteriosus. Number two, we have the papillary muscles, anterior, posterior, and septal, and we have the moderator band. Okay? Now, if we go to the left atrium, there is nothing much. It's mostly smooth except the auricle. Why? Because it receives the four pulmonary veins. Otherwise, nothing much. This is the impression left by fossa ovalis from the other side. Okay? But when you go to the left ventricle, the first thing that you will notice is thickness of the muscle. The muscle of the left ventricle is 3 times as thick as the muscle of the... Why is that?
So there's
Number one, it forms the apex of the heart, right? The left ventricle. It is thick because right ventricle will need to push the blood to the lungs, right? How far the lungs are from the heart? But the left ventricle needs to push the blood through the aorta to the whole body. So you need high pressure. That's why, and you need strength. So that's why the left ventricle is 3 times as thick as the right ventricle. Also, the cusp there is only bicuspid. It has 2 leaves, anterior and posterior, no septal. That's why you will have 2 papillary muscles, one anterior and one posterior, no septal, and no moderator band. Okay? Also, the area just below the aorta is smooth again, similar to the area below the pulmonary, and it's called the aortic vestibule. Okay? So, differences between the right and the left ventricles. Left ventricle is 3 times as thick, only 2 papillary muscles, and no moderator band. Okay? Again, the area just below the aortic cusp is smooth, and it's called the aortic vestibule. Now, between the 2 ventricles, we have what we call interventricular septum. Otherwise, there will be mixing of blood. But that interventricular septum, as you can see, it's mostly muscular, except the upper part, which is about the size of a fingernail. My nail, not yours, right? It's very small, it's membranous. And that membranous part contains part of the conduction system that's called bundle of Hess. So bundle of Hess is located in the membranous interventricular septum. But we have atrial septal defect, which is basically if you have opening between the 2 atria, which is mostly foramen ovale. Do we have ventricular septal defect? Yes, you might have an opening in the interventricular septum. And most likely, if it's going to happen, it's going to happen where? In the weakest part, in the membranous, because it's going to affect and will affect the conduction of the heart because it contains the bundle of Hess. Clear?
Yes.
Now, heart sounds, when you put that stethoscope, you will hear lop, 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 first and second heart sound. We have third and fourth, by the way. Dr. Moni will talk about them. But the actual heart sounds are caused by closure, not opening of the valve. So the lop, first heart sound, is closed by the closure of atrioventricular valves, and the dup is caused by closure of semilunar valve. Okay? So the cardiac cycle will be all non-oxygenated blood will go from the right atria, will go to the right atrium. From the heart itself? Yes, from the heart itself too, which is the coronary sinus. Okay? And then from the right atrium to the right ventricle. Passing through which valve? Tricuspid valve. From the right ventricle to the pulmonary trunk, passing through semilunar pulmonary valve. And then to lungs, 4 pulmonary veins, to the left atrium, to the left ventricle, passing through mitral or bicuspid valve, and from there to the aorta, passing through the semilunar aortic valve. Clear? Now, yesterday there was a question about the sternal angle or angle of Louis, right? Which is very important so that you can decide on the location of different things. One of them is basically where you find the apex of the heart, where you find the location of the valve, and where you find boundaries of the lungs and the pleura, where you insert a tube if you want to drain fluid from the pleura and so on. It's very important to know how to count ribs and intercostal spaces, right? So we said angle of Louis is at the junction of manubrium with the body, and it corresponds to the second costal cartilage. Now, if I tell you where would be the valve located of the heart, anatomically speaking, you would say, okay, this is the left atrium, this is the left ventricle. So junction between atrium and ventricle is here, so mitral valve will be here. Okay, now this is the right atrium, this is the right ventricle. Junction between the two, we have a tricuspid valve will be around here. Aortic will be here, pulmonary will be there. It's PAM, P-A-M, third third intercostal space, and fourth cartilage. Pulmonary, aortic, mitral, and tricuspid will be on the close to the fifth, on the right side. But no one is going to ask you where do you find the mitral or the aortic, or people are more interested in what we call auscultation areas. So if I tell you I want to listen to the valves in action, in the pulmonary valve in action, where do you put your stethoscope?
On the left side.
Third.
But you need to explain it. And you can't tell me where, but you need to explain why. Now, blood going through the valves, the turbulence of blood can be heard, right? Now, when you have a problem in a valve, whether it is stenosed, narrow, so your blood will be ejected through it, or whether it is incompetent, blood will come back. It will not be a functioning valve, and it really will. It's called regurgitation. Blood will go back to where it came from if the valve is incompetent. So the turbulence, the sound of turbulence of blood going through the valve can be heard. How do we transmit sounds? How come you hear me now?
Fluid.
My voice will be transmitted through air, right? And then through bone as well. Now the sound of blood going through the valve will be transmitted through
Fluid.
your chest wall,
Ah.
right? But before the chest wall, it will be transmitted through either the arteries, the pulmonary and the aorta, or the ventricles, right? The wall of the heart itself. So if I tell you that the mitral valve is here, so blood will be coming from the left atrium, mitral valve, and then it will be hitting the apex. So the best place to listen to mitral valve is the apex of the heart. If I ask you why, you tell me because it is the closest point to the chest wall. Okay? Now, aortic valve is here. So blood going through the aorta will vibrate the arch. The closest point of the arch to the chest wall is here, right? Second intercostal space. The closest point of the pulmonary trunk is here, in the left second intercostal space. The closest point of the left ventricle is at the lower end of the sternum. So these are the auscultation areas. They are different from the anatomical areas because auscultation areas depend on where you can best listen or hear the sounds. Sounds are caused by vibration. Vibration whether of the artery or the heart itself. So the closest point of the heart to the chest wall. If you want to listen to mitral, it will be at the apex. Left fifth intercostal space, mid-clavicular line. Tricuspid, lower end of the sternum, fifth intercostal space again, close to the sternum. Aortic, right second intercostal space, close to the sternum. Pulmonary, left second intercostal space. And you need ايش عاملينها عائلية احنا ايش اهلا وسهلا Hey, my daughter and her husband. They will be teaching you, so inshallah will pro skills. Fire? You didn't know that?
No.
Who dares to come and start waving at me like this? Has to be my daughter, you know? Fine. Okay? So these auscultation areas are very important. They will ask you about it now. When you go to the hospital and during exams and when you examine patients, they will ask you, listen to the aortic valve in action. Where are you going to put your stethoscope? What are you going to tell me? Or him or her? Right second intercostal space close to the sternum. If they ask you to listen to the mitral valve, you're going to say it is to put your stethoscope at the apex, the left fifth intercostal space. And the text is written here, by the way, in case you could not catch what I... You had a question somewhere?
Why do you listen to the the mitral valve at the apex? Or not somewhere it's closest to the chest.
Now mitral valve is here, so blood will be going through mitral valve and it will hit the wall. Last end will be the wall of left ventricle, which is the apex. Where is the apex located? The closest to the chest wall at the left fifth intercostal. Okay, so these are the closest points of whether the arteries or the ventricle to the chest wall. Clear?
Yes.
عسان اليوم. طيب, the conduction system, Dr. Zafar explained it. Now we have nothing to do with that. Why? Because conduction system is.
Specialized.
But what? Can you see anything? Can you point to SA node in the lab or AB node or bundle of S? Can you show it to me? No, these are microscopic structures. Okay, but to remind you, remember that the SA node is located at the upper end of testa terminalis, just below the opening of superior vena cava. What are they? What is SA node? What is AB node? What are the bundles? What are?
Specialized cardiac.
What do you mean by specialized? I am special, but what
Base-
does it mean?
Pacemaker.
And more.
Pacemaker.
In terms of functionality.
If not, if then
They have the ability to conduct.
Number one doesn't contract.
and transmit
They
Number two,
they have the ability to conduct the electrical.
conduct will generate.
Generate.
They generate action potential. So when you generate action potential in muscle fiber, they will. So these are modified non-contractile myocardial cells that non-contractile and they generate action potential. So the signal will spread from the SA node to the atria through the walls. The atria will contract. And after a delay of about 0.11 seconds, huh? 0.60?
16.
I thought it was 11. Anyway, doesn't matter نختلف على 0.04 seconds. But anyway, after a delay, it reaches the AV node. AV node is located where?
Between the
Where?
Interceptum. Interventricular.
In the interatrial
Atrial
septum.
septum. Yes.
Just above the opening of coronary sinus. And then from AV node, bundle of His. Bundle of His is located where? In the membranous part of interventricular septum, right? So that's why there will be also another delay because the fibers are narrow and you want to give time after the atrial contraction for the ventricles to fill up and contract. Otherwise, if they contract at the same time, what will happen? You will contract nothing. Okay? And then, from the bundle of His, it was going to divide into two branches, right? The bundle branch, it goes to it's all subendocardial. Underneath the endocardium, Purkinje fibers will be there. And the left bundle branch will go to the left side of the interventricular septum and to the left ventricle. Any questions? We'll see you inshallah.